Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Today, talking about general health is Dr. Eric Miller. Dr. Miller comes to us with immense knowledge about his field and a lot of passion for the overall health of his community. Recently, Mahaska Health shared a post about Dr. Miller, about him serving the community and the patients and families of Mahaska Health with excellence. And as a collaborative leader, he enjoys working with other staff to help individuals in their healthcare goals. He believes in a personalized approach to healthcare and strives to see patients succeed. That's just an amazing introduction to you, Dr. Miller.
Oh, thanks.
Thanks for coming in today. Tell us a little bit about you. What's your background?
So I grew up in Ottumwa and grew up on a farm, so I had a lot of experience outside, and then went to college at Central College and got my degree in biology with a minor in Spanish and chemistry, and went on up to Des Moines University to medical school and was there for 4 years. And then I did my family medicine residency in Waterloo and came back here, and I've been here for about 5.5 years now.
So you made full circle almost.
Pretty much.
Wonderful. Good. Tell me a little bit, physician. Where did that come from schooling? What made you want to take that next step to family practice?
So my mom's a pediatrician, and so I remember when I was little, I spent a lot of time on the wards with her when she'd do her rounds on the weekends and seeing kids and babies in Ottumwa at the hospital.
Okay.
I liked that, and that's kind of my first experience. Family medicine seemed like a good fit because I could see all ages then and have some variety and see lots of things.
And growing up on the farm, do you feel that had any influence on you taking care of people in med school or going on and becoming a physician at all? You hear a lot about them, a lot of those physicians come from that background of farming and they wanted to be a vet and, they chose that path instead. So I was curious if that had any influence on you at all.
I guess I did think about being a vet for a while. It does help me relate to a lot of my patients from the area though, because a lot of them are farmers, and so I kind of understand the lifestyle and some of the things they're facing anyway.
Well, and the culture. Mm-hmm. We were just talking yesterday about a patient who drove through a snowstorm to get to you and visit with you, and pretty challenging, but how rewarding do you knowing that the care that you give is so wonderful that they want to get to you when they can. So that's a neat thing.
I want them to be safe, so I don't necessarily want them all coming in and in the snowstorm. Some of these people don't need to be out driving on the roads like that, but happy to see them if they want to make the trip.
What's your typical day look like here at the hospital?
I'd say right now I spend most of my time in the clinic. I see kids through adults. I probably see more adults and older adults than I do kids. I'd love to see more kids. I enjoy seeing them, especially with that background from my mom and everything.
Okay. Sounds like you see a variety, and you have the opportunity to really talk about general health advice and everything that you have and love that you have for the community. The kinds of patients that you see, you know that eating healthy and exercising is important. What's another topic that you'd like to touch base with them on?
Yeah, I think eating right and exercising are a big part of it there, and I think I spend a lot of time talking about portion size with patients because I think that's a big part of their diet issues. But the other thing I think is important is getting outside and spending time outside, and especially with the pandemic going on right now, being outside is not a bad place to be, so people can get outside. There's lots of benefits to being outside in the environment, and especially in a rural setting like this. There's a lot of things that can be beneficial to patients. First thing would be increased vitamin D. Vitamin D is important for a lot of things, and especially it's been in the news a lot lately that having a higher vitamin D level may be beneficial for preventing coronavirus or minimizing your symptoms if you have it, but it also is important for preventing osteoporosis. It can help with depression, cardiovascular disease, and just generalized inflammation in the body. It can help with sleep difficulties and just with general inflammation, aches, pains, and improved mobility as you get older. The caveat with that is the importance of wearing sunscreen when you're outside. Sunscreen is important for a skin protective benefit anyway. It's really important to be wearing your sunscreen when you're outside or wearing long sleeves, or especially it's important those farmers they'll be wearing a brimmed cap, not just a baseball cap, but something that's going to protect the ears and the neck so we don't see as much skin cancer down the roads. Some sun without sunscreen's okay, but for the most part, sunscreen when you're outside is going to be important. Especially at that midday when the sun's at its zenith, you probably shouldn't be outside without any. People that are outside tend to exercise more for a variety of reasons. Most people spend 6 hours or more on their screen a day. When you're outside, you tend to exercise longer or more vigorously because you feel less exertion than you do if you're on the treadmill or the elliptical or something like that. And the benefits of exercise include lowering your blood pressure, but it also, in studies, has shown to increase your hippocampal volume, which helps with your spatial and episodic memory. So when people are worrying about dementia as they get older and we have an aging population, there's some benefit to that as well. Yeah. Being outside decreases your amount of depression, and part of that comes from the amount of time we spend brooding or ruminating. Just with everything we've got going on these days, people are kind of always constantly worrying or have some stress, and so that getting outside tends to lower those levels and decrease that stimulation in your subgenual prefrontal cortex to help decrease stress. Also, it helps with focus and ADHD, attention problems. You tend to focus better, and kids tend to do better on tests if they spend 20 minutes outside, and some studies have shown 20 minutes of being outside might be equivocal to drinking a cup of coffee in terms of concentration and focus. And you get those benefits even if it's cold or overcast outside and kind of gloomy. There's still the benefit to being out there even if the sun's not out. A couple other benefits of spending time outside: people that are exposed to the environment tend to heal faster and have less pain and less need for pain medications, which is certainly a good thing for a variety of reasons. And going back to the screens, children who spend more time outside typically have less nearsightedness as well. And then some studies have shown that your creativity is enhanced by 50% when you spend more time outside too. Definitely, it's a safe thing to do, especially if you're wearing your sunscreen, is spend your time outside and get outside every day for a while if you can.
Large list of benefits for just a few moments outside a day, and we can break that up a couple times a day, it sounds like, too. So obviously, specifically, you're saying, spend some time outside. With spring, summer, and fall, we all love being outside, getting the sunshine, the fresh air, and being part of the nature. We look outside right now, and there's a foot of snow on the ground. The sun isn't shining, and the nature is not inviting. What do you do when you see this outside, and what do you suggest to your patients? Because you want them to be safe. Obviously, safety is first, but what do you tell them when they're looking out the window?
Yes, definitely safety first. We don't need anyone slipping or falling on the ice or the snow. Once the roads and the sidewalks get cleared off, it's still good to be outside. I hear a lot of people tell me, the weather's not good, I can't go outside and exercise. But as long as the streets clear, the sidewalks are clear, it's still important to get out and get that exercise all through the winter too, not just in the summer. Wear your layers and don't spend too much time outside, especially when the temperatures get really cold, but it's still good to get out when you can. And
an extra caveat is don't shovel heavy wet snow.
No, don't do that either.
Easier said than done, for sure. Your patients that come into the office and they're telling you their aches and you're sympathizing with them, of course. And what are you telling those patients that can't get outside? Are you giving them some suggestions for the inside weather, or what are you telling them?
Yeah, ideally everybody should exercise 150 minutes a week for their cardiovascular health. Ideally 30 minutes a day so you get some more conditioning with it. But I mean, there's things you can do if you can't get outside. There's plenty of things you can do in the house. If you have exercise equipment, great. If not, get a couple bottles of water or cans of vegetables, and you can lift those instead of weights in your house while you're sitting in the chair if you can't get up and walk. I really encourage people to swim, especially if they have joint problems, because that takes a lot of the stress off of the joints. It's nice that you provide the information to them when they come in. Your staff is undoubtedly just wonderful to work with, and I know you collaborate across all service lines of the hospital. So a shout out to Kelly and your staff that works with you over in the clinic. The patients that visit with you, hands down, are so honored that they get to see you when they get the opportunity. Hence, no snowstorms, preferably. But they're dedicated to Dr. Miller, and the compliments we receive, daily from your patients are outstanding. They truly just have a love for your passion and for your practice that you put out and care for. So thank you, Dr. Miller, for joining us today. Appreciate everything that you do for our patients. Well, thank you. Yeah, we definitely have a great staff there across the hospital helping patients every day. Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday.
Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.